Imagine slicing your palm open on a sharp stone before there is a doctor, a pharmacy, a clean metal tool, or even a word for infection. The cut is small enough to happen in one careless second, but it is large enough to change the next week of your life. You press your hand shut. Someone beside the fire sees it. Another person tears a strip from hide or cloth-like fiber and pushes it against the blood. Nobody is thinking in modern medical terms. Nobody is calmly searching a cabinet for bandages. The first problem is simpler and more frightening. Keep the body from losing control before the group has to move again. This is the first answer to how ancient humans survived without doctors. Not because their bodies were invincible, because sometimes the first minutes after damage became a group decision. A wound was not only a private injury, it was a test of whether other people would stop, look, help, and keep watching. But stopping the bleeding was only the visible problem. The invisible enemy came later. After the blood slowed, the danger could become harder to see. Dirt in the skin, a bad smell, heat around the cut, swelling that looked worse in the morning than it did beside the fire at night. Ancient people did not need to understand bacteria to notice that some wounds rotted and others did not. They could see grit in torn flesh. They could notice that a wound dragged through mud was not the same as one kept covered. They could remember one person getting weaker after a cut, while another lived after the wound was washed, wrapped, left alone, and checked again. So the care was practical, not magical. Remove what can be seen. Keep the wound away from filth when possible. Cover it with material the group trusted. Let the injured person rest when movement would tear it open. Watch for fever, smell, pus, shaking, and exhaustion. None of this made ancient care safe. Without antibiotics, sterile instruments, or surgery, a small mistake could still become a death sentence. But the mechanism matters. Survival did not require modern germ theory at the beginning. It required pattern memory around visible contamination and visible decline. Ancient care could reduce risk without fully understanding the enemy. And the strangest evidence is not only what people did to wounds. It is what some damaged bones suggest about the people around them. A broken bone tells two stories at once. One story is impact, a fall, a hunt gone wrong, a heavy object, a limb suddenly unable to carry weight. But if that bone later shows signs of healing, there is a second story hidden inside it: time. A person with a serious injury cannot just be tough for a few minutes and recover. They need days, weeks, sometimes far longer. They need food brought to them. They need protection when they cannot run. They need someone to tolerate the fact that, for a while, they take more from the group than they can give back. That is why healed injury can become more than a body trace. It can be a social trace. It suggests waiting, guarding, feeding, carrying, or at least allowing an injured person to remain close enough to live. This does not mean every ancient group cared for everyone. Scarcity makes care expensive. A person who cannot hunt, gather, carry, or flee is a burden when food is low and predators exist. But that is exactly why the survival matters. Care was not soft decoration around ancient life. It could function like technology. The tool was the group itself, but care alone could not solve every injury. Ancient people also searched the landscape for materials that seemed to change pain, swelling, smell, insects, or decay. Look at the ground around a prehistoric camp, and it stops being just scenery. Leaves, bark, resin, ash, smoke, fat, mud, fibers, water, heat, every one of them could become a question. Does this cover the wound better? Does this keep insects away? Does this calm pain? Does this make swelling worse? Did the last person recover because of this material, or despite it? That uncertainty is the center of ancient healing. It was not random in the way modern people often imagine. People watched outcomes. They remembered warnings. An elder could stop a younger person from touching the wrong plant. A caregiver could repeat a wrapping material, because last time it seemed to protect the skin. Smoke might matter because insects avoided it. Resin or ash might be valued because it changed texture, smell, or coverage. But this was not modern medicine hiding in the forest. Without laboratories, controlled testing, dosage, or diagnosis, trial and error could mislead. A substance could irritate the wound. A poisonous plant could be mistaken for a helpful one. A person might survive for reasons nobody understood, and the wrong explanation could become tradition. Before pharmacies, the landscape became a dangerous memory bank. But the hardest survival problem was not always a wound from outside. Sometimes the danger came from the event every group needed to continue. Now move away from the cut hand and into a shelter where the whole group has gone quiet. Someone is in labor. Children are kept back. Water, warmth, cloth, or hide, and experienced hands become the tools available. There is no hospital light, no monitor, no operating room, no emergency transport. There is only a body under pressure and people who have seen this before. Childbirth changes the question. Surviving without doctors was not only about treating accidents. It was also about facing predictable body crises that every generation depended on. Helpers could provide privacy, positioning, warmth, water, reassurance, and careful attention after birth. They could watch the newborn, notice exhaustion, Remember which actions seemed to help, and which moments meant danger was rising. But again, the boundary matters. This was not modern obstetrics. Bleeding, obstructed labor, infection, infant distress, and exhaustion could still turn the shelter into a place of grief very quickly. The lesson is grim but clear. Some body crises became shared operations. The group surrounded the vulnerable person because the future of the group was inside that room. And that same logic mattered when the body did not need birth support but months of repair after a bone snapped. A broken bone is not only the moment of impact, it is the long aftermath. Picture a hunter slipping on stone, a gatherer crushed under weight, or a child falling badly near camp. The first shock is obvious: pain, swelling, a limb that cannot be trusted. But the real survival problem begins after everyone realizes the person cannot move normally. Ancient care here was basic and practical. Support the limb, keep the person near shelter. Reduce movement when movement makes the damage worse. Use sticks, hide hands, or another body for support. Bring food back. Help the injured person reach water. Shift tasks so the group does not depend on someone who cannot stand, carry, or flee. No one should imagine precise modern orthopedic treatment. Many fractures would heal badly or not at all. A crooked repair could mean lifelong pain, less speed, less strength, and permanent dependence. Infection could enter through broken skin, hunger could make rest impossible. But when recovery did happen, it was not just biology, it was logistics. A broken bone forced the entire group to rearrange time, food, protection, and patience. A fracture was a scheduling problem for survival. But even when care worked, the ancient world kept a brutal accounting. Every solution still had a failure rate. This is where the romantic version of ancient healing has to end. Some wounds were cleaned, wrapped, and still worsened. Some fevers rose through the night while everyone watched and had no way to stop them. Some births became emergencies that experience could not fix. Some broken bones left a person unable to travel. Some materials chosen from the landscape probably helped. Others probably did nothing or made things worse. Ancient survival was partial, uneven, terrifyingly dependent on luck, severity, weather, food, and the people nearby. Imagine the night vigil: a sweating face near the fire, anxious hands with a water bowl, a wrapped limb that smells wrong, a caregiver who has already tried the things they know. There is no hidden backup system, no ambulance coming over the ridge, no sterile room waiting in the next valley. If the body crosses a certain line, the group can only witness it. But even that failure could become knowledge: the empty sleeping place, the dangerous plant, the wound that should not be touched, the fever that followed a dirty cut. These could become warnings. A death could turn into a rule. A near death could turn into a story told before the next person made the same mistake. So the correction is this: surviving without doctors was not proof that ancient medicine was enough. It was proof that humans kept learning under terrible odds. The final answer is not one herb, one technique, or one tough body. It is something larger and stranger. Memory itself became a survival organ. Return to the first image: the cut hand near stone, the person pressing blood back into the body, the group gathering before the injury becomes a disaster. Now the scene means something different. The hand is not saved by a secret ancient doctor. It is surrounded by systems that do not look like systems yet. Someone who has seen a wound before, someone who remembers which material irritated the skin, someone who knows to keep dirt away, someone who brings food when the injured person cannot work, someone who warns a child not to repeat the mistake that killed another person. Before doctors, medicine was not a profession. It was attention. It was watching. It was care under pressure. It was a group storing survival knowledge outside any one body. Modern medicine is not the same thing as ancient care, and that difference matters. A clean bandage, antibiotics, surgery, safe childbirth support, and emergency treatment are not small comforts. They are the result of a very long human refusal to forget what pain taught. Ancient humans survived without doctors because they were not alone, and because memory turned suffering into instructions for the next body.